Hump Day with Dr. Alex Earle, and today we're going to spend some time talking about our devices, but it's going to be a little bit shorter than my usual Hump Day today. Unfortunately, I have been running the OR all day. We had 4 cases today, which went great, but it took me a little while, and so we're starting a little bit late. I'm going to have to end a little bit early because I have more work to do at 5:30. All right, but let's go over this quickly. I think it's important because a lot of people ask about these adjuncts or things that you can add at the time of, say, liposculpture, HD lipo, or BBL. And so what are the machines or the tools or devices that we have in the operating room that can help for those procedures? And so we essentially have 2 important machines that we use in the OR, other than, of course, like our regular tools that we use for the actual liposuction itself. So in terms of the actual liposuction, we use what's called the micro-air, which is a PAL system, and PAL stands for Power Assisted Liposuction, okay? So that's what we use for the actual liposuction portion of the procedure. But there's things that we can add in addition to that. And 2 of the most popular things that we have here are, number 1, the BodyTite, and number 2, the Vaser with a V, okay? Not an L, but a V, a Vaser. And it's very different, and I'll explain that here in a second, okay? But let's start here with the BodyTite. So the BodyTite, I've been using this for quite a few years now, and probably a lot of you have heard me talk about it. But it's a device that helps with the skin tightening portion of the procedure, okay? And so what it uses is a specific type of energy that is called RF energy, or radio frequency type energy, okay? So that's what the BodyTite uses, radio frequency type energy. And the purpose or the use of the BodyTite is, as the name implies, for skin tightening, okay? It's for skin tightening. Not muscle tightening, not any other type of tightening, but for skin tightening, okay? And there's a few features that I like about the BodyTite as compared to some of its competitors. So it's not the only RF energy machine out there. There's another one which you also may have heard of. It's called Renuvium or J Plasma. So that's the other machine out there that uses the same type of RF energy for the same indications, which is for better skin tightening or better skin retraction, okay? Now, the BodyTite has several different handles that we can use. These are all one-time use handles, meaning it comes in a sterile package, you open it, you use it one time in one patient, and then you toss it, you throw it away, okay? And so it has different handles. It has a very small one, which is the FaceTite one, and that's the one that we use for the chin, okay? And then it has the bigger one, which is actually the BodyTite handle, which is the one that we use for larger areas of the body, such as the abdomen, the thighs, the arms, the back, or pretty much any other large area, okay? It also has a little tiny one, which I don't use it as much, but other people use it for things such as like the lower eyelids or lower bleph, or even for a non-surgical vaginoplasty. It's a possibility to use the AccuTite, which is like the tiny version of the BodyTite, okay? And how do you use it? So in terms of the order of things, the BodyTite is typically one of the last things that we do. So when you're doing a liposuction case, the first step is to put in a bunch of fluid. It's called tumescent fluid. That fluid has a medication called epinephrine, which helps decrease blood loss, okay? And so you put in the tumescent fluid, and then you do your liposuction, and then once you're done with the liposuction portion, then you use the BodyTite to help tighten up that skin, okay? It works well. Some of the favorite areas that people like to use the BodyTite are the inner thighs and the arms, okay? Those are probably the 2 most popular areas for the BodyTite. The most popular area for the smaller version, the FaceTite, is the chin, kind of chin and neck area, okay? And the way it works is that, like, once I've done the liposuction, then I'll use the probe. The probe actually has 2 prongs, one that goes above the skin and one that goes underneath the skin. So it's not something that's like completely can be done, say, for example, in the clinic setting. It generally has to be done in the operating room under anesthesia, okay? Because it has the 2 prongs. So one's going to go above the skin one's going to go underneath the skin, almost like a liposuction cannula. All right, and so it imparts the energy from above and below, this RF energy, okay, and that then heats up the skin, and the skin can heat up to about 38 degrees Celsius on the outside and up to about 68 degrees Celsius on the inside, okay, and then in the process of heating up that skin, it creates a reaction which then brings more collagen to the skin and then allows the skin to tighten up, okay? How long until you see the results? It could take up to 6 months to see the full results, okay? So you may not see the full effect of it immediately, okay? You're probably going to be seeing immediately, you're going to be seeing the effects of the liposuction portion of it, but not so much the effects of the BodyTite. So the BodyTite can take, again, up to 6 months to see the full effect. Okay? All right, so that's BodyTite. The second device that we use was actually my favorite device in the operating room, and we're one of the kind of the masters of this device here in South Florida, is what's called the Vaser. Okay? Again, Vaser with a V, not an L, because it's very, very different. The Vaser with the V, which is what we use, uses a specific type of energy which is based on ultrasound. So it uses ultrasound energy, okay, vibratory type energy, as opposed to a laser, which uses actual laser energy, which is a light-based energy, okay. There is such a thing as laser with an L lipo out there. Some people used to call it smart lipo. You don't see it much anymore. It's not very popular anymore because it caused a lot of problems, a lot of complications, and a lot of issues with the skin and scarring and fibrosis. So we're not talking about that, okay? And I don't recommend that. I do not recommend laser lipo or smart lipo, okay? But I do highly, highly recommend the Vaser. The Vaser is an awesome device. It uses this ultrasound energy to essentially knock off the fat cells from the surrounding tissue. The technical term is called emulsify, so it emulsifies the fat. But you can think of it as these sound waves causing vibration that knock off the fat cells from the surrounding tissues. And so that then allows for a lot of advantages. It allows for increased fat removal, so you can get more fat out, but you can do it in a way that's less traumatic. You can do it in a way that there's less bleeding and less inflammation, which is awesome. And on top of that, because it also does impart a little bit of heat along with it, it also improves the skin retraction as well. So it definitely helps with skin retraction also. So the Vaser is an awesome device. Again, it has a lot of advantages, including better skin retraction. And it's also a device that we use in people that have scar tissue or fibrosis, because it helps kind of soften up that tissue, that scar tissue and fibrosis, before then trying to go in and trying to smooth things out. So great, great device there. I use it for all of my liposuction cases, my lipo 360s, liposculpture, high definition liposuction, BBL. For all of my lipo cases, I use the Vaser. And you can use it in any part of the body. It can be used in the abdomen, the arms, the thighs, the chin, etc., any part of the body. And it's extremely helpful when doing high definition liposculpture, because you can be very precise with it. So when you got to etch out the abdomen, for example, and etch out the six-pack and things of that nature, you can be super precise with the Vaser in order to create that beautiful definition. All right? Okay, happy to take any questions.
We have a view on
Yes.
how do I know if I need implants with my breast lift?
So that's a great question. So so first of all, yes, it is quite possible to do a breast lift with or without implants, okay? So that's gonna depend on several factors. Number one, what's the look that you're going for, right? Do you wanna have a more kind of, more natural look, so lifted but very, very natural? Or do you want to have a look where you have, say, more volume in that upper pole of the breast? So if you want to have that look with more volume in the upper pole of the breast, then most likely you'll also need an implant. Also depends what caused the breast to sag in the first place. A lot of times it was due to massive weight loss, and typically you've also lost a lot of volume in the breast as well, especially in that upper pole. And for those particular patients, we may need the implant just to give you back some of that volume that was lost with the massive weight loss. So the best way to tell is to send in an evaluation. So send in, go to our website, go to the virtual consultation, send in your questionnaire, send in your photos, and then based on that and your desires, I can make a recommendation as to whether we should use implants or not.
Just join here. Is Vaser similar to J plasma?
So no. So good question. But the one that is more similar to J plasma is the BodyTite. Okay. Excuse me. BodyTite and J plasma use the same type of energy, which is this RF energy. Okay. And so those are similar. But the Vaser is completely different, okay? It uses a completely different type of energy, which is ultrasound energy, okay? And so you can combine them. You can actually do both BodyTite and Vaser. And a lot of times we do that for our high definition, pure total definer package, which I highly recommend, by the way. But you can combine both of them because, they do work and act differently.
Okay. Doug, what's the turnaround time for Vaser?
So the Vaser is something that we add to your liposculpture procedure, okay? And typically, if we're going to be doing a Vaser of the entire trunk, meaning the entire abdomen, flanks, and back, it's going to add about 30 additional minutes to your procedure. So say if your regular BBL takes, 2 hours, then your BBL with Vaser might take 2 hours and a half.
I will answer this one because this is for the marketing people.
Oh, okay.
If you are currently booking for April, so there's one spot that opened just now, just one for April, one.
That's it?
Yeah.
Just one for April? Okay.
Yes, don't you book?
All right, I guess we're pretty booked through April. So if you want that one spot, you better go ahead and call us right now and see if you can grab it. But otherwise, probably book it into May and June.
Great. Another question, Doug. The classic question, but it's needed because 4 times the same question. Can someone get a BBL and a tummy tuck at the same time? Or what's first, the tummy tuck or the BBL? So this is mash up in one.
So yes, very common question. I think we get this almost every single live. But it's a question that's on everybody's mind. And I think it's confusing because different doctors say different things, right? But I'm going to tell you what I think, what is my recommendation and what I think is obviously the best recommendation, which is to not combine those procedures. So I do not combine a tummy tuck and a BBL. And there's several reasons for that, okay? First of all, there's regulations. So here in Florida, we are regulated by the Department of Health, and the Department of Health says that when you do a tummy tuck, you can only remove 1 liter of fat via liposuction, which typically is not enough for your typical lipo 360 and BBL, and not enough to transfer to the buttock and hips to make a significant difference. So that's number one. Number one are the rules, right? And the rules in Florida are not the same as the rules, say, in New York or California or other countries such as Canada and Mexico, or Dominican Republic for that matter. Second, I even if I could do it, like if I didn't have these rules, I wouldn't do it because the complication rates are very, very high. They're much higher. You have all the complication rates of the BBL, plus all the complication rates of the tummy tuck, and they don't simply add up, they kind of multiply into each other. And so the risk of things such as skin dying, so skin necrosis, infection, and importantly the risks of bleeding, needing blood transfusions, and the risk of blood clots that can go to the lungs and cause a pulmonary embolus, which can land you in the hospital or worse, and go much, much higher when you combine these procedures. So I don't recommend it for that reason. And then last but not least, recovery is super tough, right? Because you're supposed to be like on your back for your tummy tuck, but you're on your belly for your BBL. So it's like, oh, now what do I do? Well, you definitely can't be on your tummy with the tummy tuck. That's just physically impossible. You're going to ruin that whole thing. So you end up being on your back, and you compromise the results for the BBL because you inevitably are going to put some pressure on either the hips or the buttock, and that's going to compromise your results. So it's not even worth it. So why are you going to increase the risk for less results, right? It makes no sense. And so you're going to separate them, and you're going to do your tummy tuck first, all right? So always, always, always do your tummy tuck first, and then come back 3 months later and do your liposculpture BBL.
Okay, quick.
Yes.
Is inner thigh liposuction done as a standalone procedure? Do you see success with that procedure?
Yeah, it can be. It can certainly be done as a standalone procedure. It can be done as an add-on procedure as well. And for most of the patients that want to do their inner thigh lipo, for most of those patients, we typically are combining it with the BodyTite to help the skin retract as well. Because oftentimes what you find in the inner thigh is not just some excess fat, but also some skin laxity or some looseness to the skin. Yet that patient, probably doesn't want to have that big, ugly kind of thigh lift scar that goes all the way up and down the leg or even into the groin crease, which can become very uncomfortable. And so then the next best option is a combination of liposuction with BodyTite.
Last one.
Yeah.
Will a tummy tuck help you give you more a hourglass figure?
It depends if you go to the right guy, all right? But it can and it should. I think, it should do that. And of course, you got to go to the right person that can give you that hourglass figure, kind of bring out that underlying shape when you do your tummy tucks. And so how do you do that? So there's a few techniques that we use to help bring out that shape, bring out that hourglass figure. Number one, when we do the muscle repair on the inside, we really want to tighten things down, especially at that waist level. So you're kind of creating like an internal corset, if you will, from the inside. And then from the outside, we're going to be doing some liposuction along the flanks and the waist to really kind of, again, bring in that waist and bring out that hourglass figure. And there's one more thing that you can do, which I highly recommend if you want more curves, is to add then also a fat transfer to the hips at the time of your tummy tuck, okay? So that combination of internal corset, flank and waist liposculpture, plus fat transfer to the hips will definitely make you have a beautiful hourglass shaped tummy tuck.
The last one. Have you or
Wait,
doctor?
you said that last time.
Yeah, but this is important. And she asked, please answer my question. Answer my question.
All right,
So
all right.
if you,
We'll do it.
Yeah, if you or Dr. Wiggery have performed surgery on grade 3 ptosis breast.
Of course, that's like almost bread and butter. But yes, we do surgery in all sorts of, all grades of breast ptosis, okay? So yes, grade 3 ptosis is kind of the most severe ptosis. That's when the nipple position is at the lowest point of the breast. But it's also very, very common. It happens oftentimes after pregnancy and breastfeeding. It happens oftentimes after weight loss. It happens oftentimes just because it happens. So this is very common. We're super comfortable with that procedure. Pretty much do it every day, day in, day out.
Oh, that's it.
All right. Okay, well, sorry today was a little short and sweet, and we started a little late. It's busy over here. But I look forward to seeing you guys next week on Hump Day with Dr. Alex Earle. All right? I'll catch you then. Take care. Ciao.